Thank you, Arash. Really quickly, those of you who filled out a survey, there are prizes that were associated with that. So they're at the back registration table. Thank you. If you'll go back there, the first gift card, the first one's a Starbucks gift card. That's Anna Furstenberg. Second one was a $20 Starbucks gift card. Megan, I'm going to butcher your name, Nykodum. $20 Sunrise gift card. Sunrise Cafe, Heather Shoup. An iPod Nano, Dave Strobolakos. Las Vegas Knights versus Carolina Hurricanes, Richie Dupletion. And Las Vegas Knights versus San Jose Sharks, Soraya Silverman Montano. So if you heard your name, go back to the back, claim your prize. If they're not here, I have a second runner-up and a first runner-up and a second runner-up. So we'll just keep awarding people out until we get rid of those awards. So first of all, thank you guys so much. There's a lot of data, as you can see on these boards. There's a lot of information you guys provided. And I just want to go through a couple of things really quickly. There's going to be little stickers and sticky notes up here on this table and then over here in the corner. If you hear something that you want to me to or you want to add some other clout to, prioritize-wise, come on up while I'm talking. You won't disrupt me or distract me. And go ahead and feel free to put more notes on the board. So we're going to start with LGBTQ around strengths and opportunities. Generally speaking, we have things around, there are opportunities around funding. There are a lot of LGBT programs that are peer-based, have foster and mentor programs that exist in our community that we can leverage. We have safe places in our community that are non-judgmental. We have the center that is specifically, their vision is specifically based on serving LGBTQ population, and they are a resource that we could use more and kind of grow that strength and opportunity out. There's a lot of collaboration on the personal and organizational connection levels that we see with the LGBTQ population in Southern Nevada. So that's something that we can use to grow in this area. Representation, there's an increasing positivity amongst our LGBTQ population in Nevada and generally across Southern Nevada, which is a huge opportunity and a huge strength as we try to address LGBTQ population-related youth homelessness. We also have more data coming out in HMIS systems for communities, and there's more transparency around this issue, which is certainly something that we can utilize moving forward. There's more education and educational programs and opportunities out there and information around parent and family needs, as well as some literature and kind of that's readily available that we just need to be able to connect to other areas of our community. And training is starting to pick up in more of these areas from the Department of Family Services, from foster care. And we need to grow that more, but we already have some programs that are in existence that we can start to utilize to expand our services to LGBTQ populations, specifically around youth homelessness. So if we look at barriers, gaps, weaknesses, and threats, there's a really big issue here, and it's noted in a lot of your feedback, that's related around civic and religious beliefs and communities, and how do we bridge those gaps? How do we take some of the stigmas or beliefs that we have in our own person and some of our communities, and how do we bring those down and those vulnerabilities down so that we can bring more services to a population that's in need? And how do we address those issues and how do we communicate with those organizations? And how do we communicate with those people who have a fundamental belief that stands against LGBTQ and the youth population? So that's one of the big barriers that we have to try to figure out. How do we bridge those gaps? How do we provide services in those arrays? How do we connect those resource providers for some of those people who are maybe just need information or able to kind of share that openly or just bring down some of those walls? I think this is juvenile justice based, legal and political based, reducing sentencing for homeless youth. That was brought up, especially that kind of carries over from juvenile justice to school-based programs, that once they fall into this trap of being sentenced somehow through a process or coming into trouble with education programs, with schools, with juvenile justice or law enforcement, they're trapped in that, right? And there's it was brought up across a lot of boards that there's a lack of training available for teachers, new teachers, existing teachers, staff members at CCSD and schools where we could infuse more information into those people. We could invest more in those people who are constantly connected to our youth in order to bridge some of these gaps. We need to revamp our sex education program. That was brought up across the board, that there's a lot of issues where we overgeneralize things. They're old content materials. We need targeted programs, targeted training, targeted resources for LGBTQ youth, and that will, again, bring down the stigmas, bring down some of the other barriers that we see. We don't have LGBTQ-specific shelters. We need more transitional, more housing services. We need that across the board, but we need those for specific targeted populations as well, and that's one place to start. Foster homes and funding around those arenas, especially for LGBTQ youth. Again, we need more foster homes. We need more funding for foster families. We need training for foster families. We need to be able to keep them in the system as foster families so that we have good, reliable people that we can place youth with when they are runaways or they are throwaways or whatever their situations or circumstances may be. We need to have more drop-in and outreach from the LGBTQ providers that are out there now. Have them drop into our agencies. Have them cross-collaborate. Bring them in to talk to your schools. Access some of these other resources that we have in our communities. And again, back to the churches and faith-based communities. We need to start bringing some of these welcoming ideas, safe places that we have in our schools, starting to foster that in more of our community organizations, reaching across some of the barriers that exist just in some of our beliefs, some of our social structures, some of our zip code-based or area-based barriers. We know that poverty exists in certain regions, certain areas. We need to start bridging the gaps across those. And then temporary housing and other support in that arena. I have more. Awareness programs. Sorry, another sheet here. Awareness programs for parents, outreach programs, school clubs. We need to be able to find more data to separate identity, gender identity from sexual orientation. And you can see that in the YRBS data. They don't currently track certain data. It makes it really hard for us on the data side to be able to address policy and programmatic issues when we don't have data that identifies where some of these issues may lie. We need to have more expanded use of the HMIS system or change that somehow. I know data collection systems and software applications, they don't always work, right? We have to integrate a lot of different data sources. So we need to start thinking really strategically about how we can utilize different data sources, connect them through unique identifiers, and start to build out a more robust analysis and understanding of what we have in our communities. And then speaking to something that comes up all the time in these areas, healthcare and mental health. We're growing in that capacity. We have the UNLV School of Medicine now up. We have Turo. We have nursing programs. We're growing in that space, but we're also very limited. And so we need to start putting targeted resources, targeted mental health and healthcare practices, programs, evidence-based, whatever you want to do in these specified locations, in schools. Yeah, that kind of generalizedly captures that. Sorry, I'm trying to go through this. We've got 12 boards to do. So assets, partners, intersections. We have current housing resources. We have existing shelters. We have existing service providers. We just need to start connecting the gaps. We need to start bridging some of those, offering more services, growing the funding capacities. Having case management, that's been working in some of your guys' shelters and housing resources. We need to expand that case management so that we can kind of identify some of these issues, stop them at point one so that we don't have person coming in second, third, fourth, fifth time, et cetera. This came up across all boards, and I'll bring it up now. We've had success in this in other areas with resource guides and resource directories. Printed guides, as you know, go out of style the second they're printed, right? It's like worse than computers. You buy it 6 months ago, it's already bad. But if we could get to where we have an online directory where we could put like the 211 that already exists, and we can start to grow that out for our community, start to actually use those resources, put your community organization information out there, and then make it accessible. Start to educate people on that. Make them aware of it so that they can go out and update it, utilize it, because one of the things that we heard over and over again, you can see it on these boards, we don't talk to each other enough. There are silos in our policies, there are silos in our programs, there are silos in our communities. And bridging those gaps, having accessible resources, is imperative as we move forward. We talk about this, you see existing resources that exist with the center. There's LGBTQ specific resources here in town, support groups. All of those things we can grow out to our youth. They currently serve adult populations. We're a top 10 nationally with 4.3% of our population being LGBTQ. We have an adult population that we can reach out to. I'll tell you that 39% of our LGBTQ adult population have kids. They already have youth. We can reach out to those individuals as adults, start to mentor kids as they're coming up, stop some of these issues from occurring recurrently. Health resources, again, that targeted prevention, targeted healthcare, targeted case management. And then just revising programs like we already talked about with health education and sex ed. We need to showcase that we care about this specific group of people. We need to have targeted resources for them. We can design standardized trainings. I do it all the time. But what we need to do is have standardized training that we have targeted specific information. So you go through training A, well now here's something that's subset specifically for this population. That's going to come up on all of these boards. So now we're going to change out. Let's go to immigration, I think. If you have anything to add, you can come up and keep adding it if you'd like. They'll be available even after I'm done. So immigration, let's start with strengths and opportunities. Again, talking specifically to resources. We already have resources out there. We just need to start getting more access to them. Educating our service providers, educating our school districts, employees and teachers and staff, et cetera. And then this is something I see commonly in the health stuff too, in the clients that I've worked with. Documentation available in multiple languages. It seems like it should be happening, but it doesn't. How many people go into a doctor or go into a clinic or they go into the bank and they can't read the information that's out there? They have a language barrier. Now they have a financial barrier. They're underbanked. They're unbanked. Financial barriers lead to homelessness. We start these kind of trends early on. So by growing some of those capacities out, again, we're showcasing that we have 23% of our population that are immigrants. They don't all speak English. Actually, from the data, it showcases that they don't speak English very well for a large percentage of those. So by showcasing that we're offering services to those specific language areas, we're showcasing that we care. And we know by how many people are in this room and how involved people have been, that there are a lot of people that care about these issues. Opportunity to change policy and access to legal services. I think there's going to be a growing trend in the political and policy arenas where we're going to be able to start instituting a lot of change. When all of the kind of rhetoric and bantering calms down, which they always ebb and flow, there's going to be huge opportunities to start instituting new policies, and it's going to come from here. It's going to come from the grassroots up. It's going to come from programs being infused with data, being infused with outcomes, and being able to prove that we're making a difference that will start to inform those policies and make better policies, leading to more evaluative outcomes and better programs. We need to have more assistance with filing citizenship paperwork. We have people that do that. We just need to grow it. Alternative pathways to citizenships. And then engaging our elected officials to strengthen and keep DACA. Keep some of these legislations in place. Let people know that this is an issue that it works, right? It's working well. We need to keep those things that are working, not throw them out. And then connections between immigrant services and school districts. Again, there's a lot of opportunities from the school district setting and then all the way up through higher ed. If we can start those conversations, we can start to bring down some of the barriers. Moving to barriers, there's a lot on immigration. So I'll try to go through these pretty quickly. A lot of this kind of all revolves around a recurring theme is fear. If you're undocumented and you go in for support and you say, hey, I'm undocumented, well, there's a good chance that if that gets reported, you're going to be deported. So we need to start to bring down some of those, confidentiality, bring that up, start to try to reach out and say that, hey, just because you come in and ask for resources, we can get you those resources. You don't just have to get, ushered out of one of our borders. And that's low. Those fears are not just stopping people from accessing services, it's stopping them from asking. It's stopping them from gaining knowledge, and that's a big problem. And that leads to vulnerability. They're at increased vulnerable statuses with stigmas, with peers, with law enforcement, with juvenile justice. They have other racism and other hate stigmas that are associated with them when they come in the door, so that there's more issues related to them coming into a place saying, this is a safe space for me to come into and get services. Legal solutions, we just need to figure out a way that we can provide more documentation support, try to bring down some of the length of the legal issues, resolutions, and make sure for those youth whose parents have been deported or in process of incarceration or deportation, that we have a way to identify that in our schools or in our service providers, and we have an immediate support system there to keep them afloat. Because one of the things we see in the data is that once they go into foster care situations, it's not really foster care for immigrant children. It's with a family friend, an acquaintance, and those people don't get foster care financing. So what precludes them from just saying, you're out the door, and then of course they fall right into the 1 in 3 who are lured into prostitution, the more than 33% that engage in survival sex, and God forbid they are also an LGBTQ youth, because now they're 3 times more likely to have that kind of outcome. So certainly being able to connect services at point in time of issue would be huge. Back to the local data, that is a recurring theme. We just need more data, more efficient ways to collect data, more reporting on it, more awareness of it, and ways that we can collect data around undocumented individuals in our community without deporting them. Looking at lack of funding and services, again, fear came up time and time again. A lack of services, the lack of availability, the lack of access of services. And this comes up in veteran space, which I do a lot of research around too. There are programmatic requirements of some of our funding mechanisms that basically don't allow us to provide services under those funding models. So finding ways that we can bring in other funding situations or funding sources to be able to supplant some of our programs when we have undocumented or immigrant children, immigrant youth who are affected by these issues. How do we kind of blend, pool, and braid those funds together in order to be able to provide services when some of our federal and state and even local funding programs don't allow that? And then again, back to the displacement from legal services and trying to, have attorneys and legal offices that when they're working with a family or an individual that's being deported, that they can connect that youth to a service provider. Again, that collaboration and intersection. Financial, we have really good existing financial literacy programs in our state. We have a lot of these things that exist. We just need to connect some more resources for immigrant families, for youth who are immigrants, for their parents, to provide some funding for those foster families that will make them less likely to kick out or basically just allow the youth to leave. Community-wide and funding and programs that kind of address these and address the targeted spaces. And then there's a lot of outcomes related to budgets where we just don't have the budget from the federal or state or local service provision perspective that lowers the potential for outcomes in immigration space. So again, trying to link up with successful programs in those areas would certainly be helpful. And then there's a lot of policy and legal issues that we've talked about already, where we see the policy environment right now is just, it's difficult, it's clouded, there's a lot of misunderstanding, and we need to get more resources out there, certainly bridging those language barriers. Looking at assets, partners, and intersection for immigration, there's government programs and housing, the Latin Chamber of Commerce, since we know that a lot of our immigrant populations here are Hispanic. We also know that they're overrepresented in LGBTQ populations. There's Homeland Security, and I'm not even going to guess what that says on that. I didn't write this one, sorry. I couldn't write all of them. So the library came up over and over again too. There's free technology services, it's a safe place, there's language services, but they're not being utilized a lot. So again, trying to connect these resources together. When a student comes into the school, there maybe not as language support, there are libraries around town that provide those services. Public libraries are only as good as their funding and the number of people that come in the door. So let's get more people in those doors so we can keep those libraries open, keep those free, safe spaces available. Schools, there's, CCSD has student organizations around immigration. It's just infusing that from the beginning that, we start to, you look at kids, right, when they're really little. They don't know if you're anything. It's just you're a friend to play with, right? Let's start to kind of connect those school organizations, starting as early as we can with early Head Start and Head Start programs all the way up through elementary, secondary, and then into our higher education populations. Again, the faith-based services come up here again. They offer free services, support systems, but we need to be able to get information to our faith-based organizations so they can connect people to resources that are available in our communities, so that when you're going in one door, you're not leaving with questions. You're going in with a directive to say, hey, you can go see so-and-so over here, and they have those services available for you. Starting to connect those dots will be certainly very helpful. Data collection. We talk about this all the time from a policy and program standpoint. We need to start collecting data that informs our evaluative capacity. We need to start collecting data that has the outcome in mind so that we can implement our programs with the end in mind and say, hey, you know what, at the end of the day, we want to prove this. And our data leads us in that direction, and our implementation of our program leads us to that outcome. So that was something that came up again across the board, and specifically with immigration. And then just sanctuary advocacy and protection programs. We have those in place. We just need to start to provide more resources around that. And then citizenship support from our legal community and how to connect people to those resources. So now we're going to trade out to human trafficking. So, excuse me. Human trafficking strengths and opportunities. There are some general themes around law enforcement and juvenile justice, program development, awareness and education programs, medical, again, the faith-based opportunities, and some general feedback. So beginning with law enforcement and juvenile justice, these all kind of, we have opportunities to stop some of these long-term issues with holding offenders accountable, providing those services and resources upon first criminal report of things around human trafficking, where we can provide the services right then and there and get those things done more quickly. We already have a fairly good reporting system. There's a lot of data out there around crime, VOCA, certainly the Victims of Crime Act, there's a lot of data reported there. But we need to allow and we need to enable, encourage, and empower our law enforcement and juvenile justice community to help us in this process of solving this problem. Our service providers working with our law enforcement and juvenile justice specifically to connect those resources. From a programmatic development standpoint, we need to expand programs and develop additional programs related to human trafficking. I'll tell you from a crime perspective, the state just started reporting this in 2015. 216 crimes, I think, were reported, 206 of those here in southern Nevada. I expect those numbers to continue to climb. We just started reporting it. So it's a growing concern in our community that we're at the kind of the cusp of where we can start to make immediate impact on that long term by designing programs and services that meet those needs now, before we start reporting them 10 years from now and we haven't made any progress. Awareness and education, creating campaigns, advertisements, encouraging communication lines, kind of getting away from some of the rhetoric that we hear so often and start to bridge the gap from victimization to recovery, and providing a means by which that person can go through that process and serving them along the entire process. And you're going to hear about this in the education piece, this kind of phased approach, this tiered approach of support programs. Medical, we have HIV and STD screenings and medical services. We just need to do more of that. I know there was we have rape kits available. We have other services that are available. We just need to start pointing people in those directions. We need to start holding, again, criminals accountable, starting to bring victims in and giving them services that doesn't continue to make them feel victimized. It starts to empower them and move them beyond the victimization that they experienced. Using faith-based organizations in order to help bridge that gap. Again, we have a lot of churches and faith-based organizations in our community. For all the casinos and all of the sin that people think are here, we actually have immense faith-based communities. So many people, so many churches that we can start to reach out to. And then, generally speaking, someone said that we have the opportunity to change lives, not just in human trafficking, but across the board. And we need to start taking that opportunity to serve those individuals. Moving to barriers, gaps, weaknesses, and threats. Safe places. We need to design more safe places for human trafficking victims. I know this is a new reported crime, but it's not new. It's been going on. It's been going on labor, it's been going on with sex trafficking, and it's moving younger and younger. And you're starting to see these long-term implications of that. And certainly that's a barrier. That's a weakness in our system, and we need to start to address that. Education and information, making government agencies more aware, policymakers more aware, program implementers more aware, community awareness, all of those things. We need to start doing that in a more standardized approach. There's too much missing information. There's too many things that we're not breaking out of those silos, especially with this area. Mental health, again, speaking to that, there's just more need for services, more need for service providers, connecting people to those service providers when we start to think that there's an issue. I'm trying to read this, sorry. Representation and awareness. Going back to the other things we talked about, just making community members more aware of services that are out there and issues related to human trafficking. How do we identify it earlier? How do we, once we identify that, how do we connect the resources so that they get the service they need before going down some of the data trails that you see? The higher rates of suicide, higher rates of substance abuse, mental health issues, bullying, all of those things. How do we stop those things from happening long term? I'll tell you, as a father of two little ones, I look at that data and I'm like, how am I going to send my kid to school one day? More than 30% of kids are getting offered drugs on school property. They're bullied electronically. They're bullied, on school property. LGBTQ youth don't go to class because they're scared of going to school. They stay home for their safety. How do we stop those? How do we make more safe places? How do we identify these things earlier so that we catch it when it's an issue that we're identifying? It's not necessarily someone comes in and we know it's a human trafficking situation. We start to know the triggers, the signs and the symptoms. We start to treat those at point of identification. Laws, policies, and justice system, there's just not enough penalties. That was one of the things that came up for abusers. We need more aging out of foster care support. We need to work with victims so they're, again, not victimized, but they're empowered to move past that victimization and not fall into recurrent victimization, which we know leads to recurrent homelessness issues. Again, there's faith-based issues and just kind of uncoordinated efforts there, and then programs and services that are lacking, especially with that population that ages out of foster care. And then another thing that came up just in general conversations were, youth who are disabled as well, and how do they fall into this entire community where we have intellectual and physical disabilities? How much more at risk are they? Just in general, and that's kind of across the board. These are just coming to me as I'm talking, so sorry. And then family in general issues as well, just in terms of family issues when this happens, how do we support family members, and then how do we just generally support, I think there's a general comment up there about something, how we support human trafficking victims, and there's just not enough out there. Assets, partners, intersections. There's a lot of existing resources and partnerships. We have Nevada Child Seekers, Cupcake Girls, Olive Crest, Embracing Project. Let's start to access some of those resources. Let's see what they do. Let's see if we can't take some of their programs and merge them over into some of our other available programs and start to, again, share with each other, learn from each other instead of reinventing the wheel, which I love to do. That's one of my most favorite things to try to do. Library services, again, free Wi-Fi. They have classes. Let's get these, utilize those free resources, send people to those safe spaces. Awareness and education, there's a lot of opportunity as we grow more in this space and understanding more about this population, identifying it, to create specific support groups, targeted programs, targeted awareness campaigns. And then the need for partnerships. We can begin with our faith-based and church-based, our therapy providers, our domestic violence, our hotlines. All of these resources exist. It's just, again, breaking down some of those silos and some of those barriers that exist and accessing some of those services across the board. Last one. At some point in time, I may need one of the oxygen masks from the, that's out there. Just take a little. I wonder if the Knights could let me borrow their oxygen. So really quickly, education, none of this is quick, that's a lie. It's because this is very important and we should take the time, so I really appreciate you guys' patience. So strengths and opportunities. Educating the public about facts and research. Citing stuff, as you see on the boards that we did in the other room, all of the little numbers were sources. starting to identify, hey, this is where we pulled this information, being transparent about how we report data, transparent about how we collect data. Because I'll tell you, as a methodologist and social science statistician, you can make data look however you want. Depends on what your prerogative is. There's a lot of things going on unethically in research these days. We need to start holding researchers and data reporting and collection procedures accountable so that we can start to really get at what are the facts, what do we believe as, not what we believe as facts, because that's a dangerous space to go into, but certainly where do we draw the line between what the facts can inform us, what they actually are, and what we can agree upon. We have Title I creates pathways out of these situations, and we can expand those services. We can expand awareness and access to those services, which we can kind of, again, get into this phased approach of how we serve students so that when they hit one program, there's another program that bridges them to the next stage of life. We see this with higher education transition from high school with bridge programs and tech prep programs and other things where there's that summer bridge between high school and college, and we start to bring students in who are at-risk populations. We could do the same thing here, where there's those bridges so that they can be successful, not just when they're getting that Title I funding in those programs, but as they move through their life into higher ed and into job training, which goes into this next point, that we have to have phases of support, right? We need to support kids when they're young and continue those support processes. We see this a lot in social welfare programs, that the dollars go away the second that you no longer qualify. That doesn't necessarily mean just because you don't qualify for the support program or the resources that you don't need them. You may need less of them, but we need to start approaching these problems and these issues with solutions that don't drop people off the edge so they go, you know what, I'd rather just stay homeless. I'd rather just stay on the welfare program that I have because I have nothing out here. I'm jumping off the ledge, and while it's independence, it doesn't look like independence. It looks like dependence. Financial literacy and education programs, planning, mentorship programs, where we support children and youth as they grow so that they understand what comes next. Can we have financial literacy programs available that the Treasurer's Office does. Can we do that something targeted for homeless youth, for Title I students that says, hey, we can go out and find a grant to support them long term and get them a college savings fund. Can we do that? I don't know why not. Let's see if we can. There are resources out there, programs out there that we can start to ping on that have shown success, that we can kind of mentor people and bridge them from secondary education to higher ed, and then hopefully into the workforce. Because that's what we really need here, right? We need homeless youth who have overcome, like we saw in the documentary, who go out and can be agents of change. That's where the story really gets real. We need more of those stories. Positivity breeds positivity. Early identification programs, training awareness, advocacy, and safe spaces. Welcoming safe spaces. We need to kind of educate folks on where those safe spaces are. It was really interesting to see how many notations of the library out there, and I've seen libraries close, and it's just one of those things where we have program resources available. We just need to utilize them more and point people in those directions. Barriers, gaps, weaknesses, and threats. So this goes back to that training. New teachers, even existing teachers, district staff, access to training and resources that includes not just the resources that are available, but strategic communication. How do I talk to a student who's facing homelessness? How can I be culturally competent and sensitive to those issues? Are there specific things I should know? These are things that we can do. There are training protocols out there. There are platforms we can use. There's an overall lack of collaboration. Parental involvement is one of those gaps that we need to address. How do we increase parental involvement in schools and education? Going back to some of the earlier comments on criminalization of youth homeless and the population with the school district, the juvenile justice programs, we're trapping kids in, we're trapping youth in. How do we kind of let down those stigma-driven walls so that we can kind of move them forward? Policy change and funding dynamics. Again, there's a need for standardized programs and policies with those targeted programs for specific populations we talked about today and many others. But we need to start looking at policy change from a standardized process and having that data to back it up, because we can't do that right now. Policies are really difficult to implement when implementation isn't built into the policy. Makes it very difficult to be successful. And then homeless benefits, speaking to what I talked about earlier, that they go away. So when I'm homeless and I'm no longer homeless, I no longer get the benefits. But it doesn't necessarily mean that I'm not at risk to go right back into homelessness. Again, having those programs that support people across the lifespan and starting to stop that reversion back into homelessness. So assets and partners and intersections, there were a lot of side conversations at the education table that were mentioned. There's a need, and we do this a lot in research, to operationalize definitions, right? We need to start defining what needs are and how people can help. Because one of the things that came up over and over again is, well, I'm really interested in this. I want to help. I have interest. I have money. I have whatever. How do I get involved? Who can I talk to? We need to have those resources in place from a community-wide perspective, and that's where I think we can get into that resource directory, that online access. If it's the 211, that's great. If it's something else that's like that, let's do that as a community where we can start to have that collaboration built in from the front end. And again, we've seen that be successful across the nation in veteran resources, and we have one here in Nevada that's a veteran resource directory available both in print version and online, but being able to do that so that people know where to go, they know where to direct people to, they know who they could potentially partner with. Do we know who we can partner with? Do you know the person? I'm sure some of you all know each other, but maybe you made new contacts today. That's the whole point, right? That's what we can start to use data information systems to do. And then finally, now I can't even read my own writing. That's really bad. That just goes right back into what I was saying, the creation of that printed and online space. The world's moving to this globalization online environment. We need to start looking at our resource provisions and social services, social welfare programs that can merge into that space so that people can go there. But in doing that, we can't throw away the printed versions, because I'm going to say this. When you look at the most at-risk populations, do they have a computer? Do they have an email address? They need printed materials. We can't forego that kind of resource provision, those multilingual resource provisions that are standardized across the board so we're serving everyone. A lot of our programs go to this. We can go on the internet, we can go online, we can be interactive. Well, that's great when you're a service provider. That's great when you're a politician or a policymaker or you're, a federal agency. It's great for me as a data person. Does it serve the most at-risk people? That's something that I think is really important to keep in mind as we go forward. And that's all of the stuff that you guys told us. And I'm going to take these back and we're going to analyze these and we're going to write a report off of this with the survey, with all the other information that you guys have provided and that we've collected, and start to inform a data-derived strategic vision and plan for NPHY to go forward so that we can prevent youth homelessness. We can end youth homelessness. And looking around the room and looking at what happened in the focus group, I believe we can get there. I believe we can get there because of NPHY, SANS, CARES, the partners, because of you guys. That's where it starts. It starts with all of this, and we'll get there together. And if you have any questions, please feel free to ask me. I can give you guys my card. I'd be happy to send you the report if you want it and continue to engage with you guys on as we move forward. Thank you so much for your participation and everything you've done today and do for our community.